James Hamill from Quoris3D and Guided Smile. One of the common things that we see during our QC step, which is a very important part of our process for our full arch guided service, is movement in the CBCT. I thought I would quickly show you this as an example. So typically this is seen in the anterior maxilla or anterior mandible. And when it gets to a certain level, the scan has to be rejected. So here's a prime example. So this is what we're looking at. This line or this ridge. Okay, so if I mark it just so that you can see it, this here. Okay, so whenever we see this within the planning software, we're immediately nervous that there's going to be some movement in the scan. So if I take you to this view, okay, so if you remember, that was around about the upper right 1, upper right 2 region. Okay, so I want you to keep an eye on the screen in the top right hand side, which is here. Okay, so as I scroll through, so currently we're at the blue line, so we're about the upper right 4, and this looks really nice and clear. So nice clear cortex around here. That's really what we want to see. So this is looking good at this point. However, as we scroll through, there's our canine. And as we move through, you're going to see now as we approach the lateral incisor site, you're going to start to see some furriness around that cortical plate. So here, and also some in the palatal. All right, so that's the first warning sign, or sorry, the second warning sign after seeing the ridge. Okay, and then we move on. So we're now getting to this upper right central site. All right, and we're going to now see here, that bit there. Okay, this bit between these two orange lines is the start of this ridge here. Okay, so as we move further on through, sorry, here, you can see this bit there. Now we're getting to around about there. So this ridge is now distorted, or this image which has been stitched together is now overlapped. So this isn't an accurate scan, and our advice to the dentist will be to retake the CBCT. All right, you can also actually see the double imaging down here as well. All right, if I take that off, see that? All right, so this scan, unfortunately, as much as we don't like to do it, we won't be able to plan on it as accurately as we would want and as I'm sure the dentist would want. Okay, so hope you find that useful.